Okay, go ahead and begin. Thank you so deeply, Sherry, for being here. And for those that are not here or present at the moment, thank you for taking the time and energy to watch and learn from our current member present and from what NADF has to share about what's going on. So first and foremost, welcome parents and caregivers to our Pediatric Adrenal Insufficiency Roundtable. Tonight, we're going to be discussing 4 topics. We're going to be talking about how your child was diagnosed, how your child is currently being treated for adrenal insufficiency, how do you care for sick days, and if you had a magic wand, what would you create to make it a better future for you and your child and others with adrenal insufficiency? So we're going to go ahead and get started just by sharing a little bit about myself so you understand where I'm coming from as your host tonight. I was diagnosed with Addison's disease in 2016. It was a rather challenging and difficult journey. And due to that, I've become a huge advocate and passionate about helping others get diagnosed and move forward, and have joined NADF as the patient advocate and group leader manager. Pre-diagnosis life, I was a performer, actor, singer, yoga instructor, and actually ran a yoga-based preschool for children 18 months to 5 years old, as well as taught in elementary schools and high schools some after-school yoga classes. And since diagnosis, I've had to take a step back from teaching and focus on healing, as we all know about that with health. And I've become more active and passionate about helping those receive diagnosis and move forward with their chronic illness journey. And that includes parents and working with children in a new capacity. So I'm really excited to be here tonight to facilitate, as well as just hold space so that individuals can share and learn from one another. So we can just dive in. I'll go over our ground rules. I know, Sherry, it's just you and I, but we're just going to go ahead and go over these. So for future reference, we all know what these roundtables will be a little bit about. So our ground rules are that we're going to give everyone an opportunity to respond to the questions. For any topic, if you prefer not to answer, you can always say pass. Please place yourself on mute while others are speaking to avoid any background noise. And know that we will be recording the call so other parents can learn from the discussion, because sometimes life happens and we are not able to attend, especially with children. So we'll dive right in, and Sherry will have you give us a breakdown about telling us how your child was diagnosed.
Okay, do you want me to go ahead? Okay.
Yes, absolutely.
Okay, so my daughter is now 12 going on 13. She was 6 years old when she was diagnosed. She was initially diagnosed with Cushing's syndrome, but that took us about probably a good year and a half to get to that diagnosis. We went through just over a year of seeing all these different symptoms. She would gain, weight, predominantly in the face and around her stomach. She would have these really weird sporadic headaches, and she would break out in hives, and sort of all these other sort of odd things that would happen. So we would call the doctor, book an appointment with our family physician. We'd get in, and by the time, we got there, the symptoms were gone. She seemed to, sort of take off that weight. And this continued, like I said, for about a year, almost a year and a half. And by the end, it just so happened it was a day in June, and I was taking her to school, and I thought I couldn't get in to see the family doctor. And there was a pediatric, it's a walk-in clinic who had a pediatrician. And I said, okay, let's go. And we've seen her before. I want her to maybe she has an answer. So I explained all the symptoms. She took her blood pressure, kind of looked, stopped, and took it again. So that was for me. I also have blood pressure issues. So I knew right away a second check is an indication of something. So, she listened to all the symptoms, and she said, basically told us we needed to see a pediatric endocrinologist because of her blood pressure. And basically we had to take her to emerge because of the blood pressure. But she said, due to the symptoms, what I think she needs is a pediatric endocrinologist. She said, just listening to you, it sounds like this thing called Cushing's. So we headed off to the Children's Hospital, not too far from us. They started the testing right away. pretty quickly confirmed that yes, it was Cushing's, but couldn't find the cause. So they did know it was adrenal and, adrenal in nature, but couldn't figure out, because they said normally it would be a tumor on the adrenal glands, and they couldn't find anything. So this went on for quite a few months of, they said it was cyclical Cushing's. That's why it was going, the weight was going up and down. They had us create a whole, I guess like a picture every month, a picture series, so that they could see sort of how the weight went and that kind of thing. And from there, they started consulting with Dr. Statakis at the National Institute of Health in Bethesda, Maryland. And sort of it was being done through consultation. And then finally, he kind of, I guess the suggestion was we go there. So we did, and actually from the CT scan that we did at our local hospital, he diagnosed her with Cushing syndrome, and it was PPNAD, pigmented, I don't remember, it's pigmented, primary pigmented nodule, you know what, it slipped my mind anyway. But and basically from there, it was we were told she had to have both her adrenal glands removed, and sort of that all happened within a month. And that was in March. We were back there in April for the surgery. She had them removed, and that's what led us to her diagnosis of adrenal insufficiency, in a nutshell, I guess.
Well, thank you so much for taking the time and energy to share that. I know going through and reliving it is an ordeal, because it's such a big deal going through the diagnosis process. And I'm so glad you were able to get an answer and understanding, so that way you could move forward with the treatment to get her all situated to move forward towards the surgery and the next steps. So thank you for sharing that. And you may have mentioned it, but do you mind just sharing with me really quickly, when did this all take place? What year was this?
This would have been, oh my goodness. Where are we at now? We're in 2021. So just over 5 years ago. So I'm like, I got to do my math there. Yeah, so 2006, I guess, was sort of when this all started.
2016.
Sorry, yes, 2016.
Yes.
See, yeah. I didn't do my math correctly. It's not my strong suit.
That's okay. That's okay.
Yes, 2016.
Well, thank you. Okay, thank you for clarifying that with me. So it's been a 5-year kind of journey that you all have been on since then. Yes. Okay.
Well, I guess technically it started in 2015. But the after part was like the surgery and stuff was 2016.
Sure. Yeah. Okay. Thank you so much. So I'm going to go over a little bit about how adrenal insufficiency is diagnosed in children, because this is part of NADF is bringing about awareness, and this may be information that you already know, but this is also so helpful for those that don't have the full understanding. So I'm just going to go through this so we make sure that we have all the important information on hand altogether. Adrenal insufficiency can be difficult to diagnose and should be considered in any sick newborn or infant. Given the life-threatening nature of adrenal insufficiency, prompt investigation and treatment are essential. A definitive diagnosis of adrenal insufficiency requires that tests be carried out. Measure amount of cortisol and aldosterone in the blood, document a lack of the normal increase in the levels of cortisol after administration of ACTH given by injection. Your child's doctor may also order imaging tests such as ultrasound or CT on the adrenal gland or an MRI of the brain. Other tests may be required to rule out other causes of adrenal insufficiency, such as CAH. Genetic tests, a physical examination, or a family history. Sometimes when there is a known family history of CAH, a fetus is diagnosed before birth. These are all such important things to keep on hand and mind as we move forward in taking care of all of our children in our community and the rest of the world. So now, Sherry, I'm going to ask if you could share how your child is currently being treated for adrenal insufficiency. Now that you've come through, you're here 5 years later, what are you doing? How are you treating adrenal insufficiency?
So Taylor takes both hydrocortisone, Cortef daily, and fludrocortisone, Florinef daily as well. She's on, for Cortef, she's on, I think it's a 15 milligram dose for the day, spread out over 3 times. She does 7.55 and 2.5 is how it's split up. And the Florinef she takes once a day in the morning. And then, you know, we have our prescription for our emergency Solu-Cortef medications. Thankfully haven't had to use it, but basically that's, yeah, so she takes her medicine and we see her endocrinologist every 6 months where they do blood work. Well, I should say we see her every 6 months, but lately every other appointment has been virtual since sort of all this started. So yeah, so that pretty much is what we've been doing.
And then the fludrocortisone, how much is that every day? You said you're taking it daily. How much of the fludrocortisone?
She takes 0.05 milligrams.
Okay.
Daily.
Okay. Thank you for clarifying that. I'm excited that you shared the dosing because there's some exciting things that we're going to share because we all know how challenging and difficult it is cutting pills and splitting pills. So excited to be able to share some new information. So I'm going to share a little bit about the treatment of adrenal insufficiency. Adrenal insufficiency treatment in infants and children with primary adrenal insufficiency. Challenges exist to achieve appropriate and adequate dosing. Pediatric Endocrine Society guidelines on PAI recommended that children are given hydrocortisone in 2 or 3 divided doses per day, and that those with aldosterone deficiency take fludrocortisone to replace that hormone and help salt fluid balance, just like Taylor. A 2015 survey of European pediatric endocrinologists found that 1 milligram or 2 milligram were the most common doses of hydrocortisone they prescribed for infants and newborns. Caregivers have to crush or split tablets to get the dose prescribed. In a small 2018 UK study, researchers concluded that there is risk of under or overdosing children due to the imprecise dosing as a result of manipulating the tablets. This is where those smaller doses come in real challenging because it's very difficult to split a 10 or a 5 into a 1 or a 2 milligram. So there is new hydrocortisone granules that have been approved for pediatric use in the US. FDA approved this in September of 2020 under trade name Alkindi Sprinkle, supported by 6 clinical studies, indicated for the treatment of all forms of adrenal insufficiency, including CAH, in infants, children, and adolescents up to 17 years old, offers the ability to accurately prescribe and administer smaller pediatric appropriate doses, provides more flexible, individualized dosing with 4 low-strength options as low as 0.5 milligrams. It masks the bitter taste of hydrocortisone, removes the need for pill manipulation like cutting, splitting, and dissolving, and it can be administered by pouring the granules directly onto a child's tongue, onto a spoon and placing in the patient's mouth, or onto a spoonful of cold or room temperature soft food such as yogurt or fruit puree. That is a huge jump as far as having to split pills manually and being able to use a powder form, these little granules, to offer the appropriate dosing and make sure that our kids and our pediatric patients are being treated appropriately. Before I move on to the next thing, I just want to ask really quick, Sherry, is that something that you were aware of or knew about?
I did hear that that had been approved in the US. Unfortunately, being in Canada, we don't have that as an option here. But I know too, and in Canada, we only actually have the 10 milligram tablets of Cortef. So that's yeah, that's a bit of a challenge. We were able to get the 5 milligram tablets through through Health Canada. It's called a special access program, but it took a lot of research and effort and advocacy, I guess, on our part to get that. And being diagnosed in the US and sort of starting her medication from there, that's how we knew the 5 milligram tablet even existed. Otherwise, if we had just been here, we wouldn't have even known that that was an option. So, because splitting a 10 milligram tablet into, you know, a 2.5 dose is next to impossible.
I was
Well,
going to
even
say,
can
I
say,
don't even know how you do that. Like once you split it into the 5 and
yeah, it was,
that's, I'm so glad that you're able to get the 5. And even though I know you are in Canada and, may not have access to a Alkindi Sprinkle at this time, I think it's so important and amazing that this kind of work is finally happening and attention is being paid to the adrenal insufficiency community, because no medication progress or adjustment has been made or attempted for as long as we've been doing it. Adrenal insufficiency has been around. So this is huge progress and steps, and only means that other areas of the world will start hopefully climbing on board and seeing the importance and the impact that's going to have for all of our communities. So I'm hopeful that you'll be able to have access to it soon. Okay, so let's talk about sick days. We've got the dosing. We know how much we take for our children. Now, what do you do for sick days? So Sherry, if you could share how you care during sick days, how do you guys handle dosing currently?
So for sick day dosing, I know some people do the double, triple dosing, whereas with our pediatric endocrinologist, they do it as 3 set doses 3 times a day. So like basically she takes 15 milligrams now daily. So when she's sick, she takes 15 milligrams 3 times a day. So morning, afternoon, and night, she's on a straight. So there's no, if the fever is this, it's double dosing, it's this. So it's kind of easy. It's just, we know if we need to stress dose, it's 15 milligrams 3 times a day.
I'm so glad to hear that you are doing that, and you are, you have a set plan and it works really well, especially since, under dosing is where the issues lie, and overdosing, the more in times of need, when in doubt, stress dose, because it's so important for all of our AI bodies to have all the important steroids so the body can function. So I'm glad to hear that you have this and been doing that protocol and it's been working well. I'm going to share now a bit about caring for sick days, and which we call stress dosing. So stress and sick day dosing in children with primary adrenal insufficiency. A child with AI will need their hydrocortisone dose increased at times of significant body stress. This is known as stress dosing and is required for fever, severe diarrhea, vomiting, or trauma or surgery. Persistence of these signs requires immediate treatment in an emergency room with intravenous saline and hydrocortisone. Each child's endocrinologist should be consulted for specific instructions on stress dosing, with the expectation that if a child is not able to take oral medication because of vomiting or lack of consciousness, hydrocortisone injections of Solu-Cortef hydrocortisone should be used. An emergency hydrocortisone injection kit should be available for such situations. Parents should learn how and when to administer intramuscular hydrocortisone injections. So I'd love to ask, you said that you had the emergency injection kit. How many do you have, and how was that whole experience as far as learning how to use it?
Well, I'm just trying to think of in regards to how many kits. One kit is stored at school, in the office. She has a kit that she carries with her. Previously, she took the bus to school to and from, so she had a kit that she carried with her. I always have a kit on me. And actually, because she dances competitively, and at the start of the season, the dance school wanted a kit stored on site as well, even though she always brought it with her. They just felt better knowing it was there just in case. So that's sort of, we have, I guess, it's 4 locations, like sort of 4 kits that, are always sort of, where she's at. I guess, so we were trained, we were shown how to use it initially, how to do the emergency injection when she was initially diagnosed. And anytime that we go to, for her endocrinology appointments, the endocrine nurse at the clinic always asks if we want a refresher, that kind of thing. So that's been a good thing. So yeah, and it's coming, I feel better knowing that I know how to use it. And like I said, I mean, I haven't had to use it, which, you know, I'm happy about, but it's just hopefully that, all those practice times in the event that I ever had to use it, that it would be, it would sort of come back to me.
I love to hear that you have so many on hand, because it is, never hurts to have more than one. And sometimes, you never know if, you know, something's going to happen with a vial. So it's great to have more than one on hand at a time. So I'm happy to hear that her dance center also has one that they keep on hand to keep her safe. Okay, so now we're getting to the fun part in my mind, because I love magic. If you had a magic wand, what would you create to make it a better future for your child and others with adrenal insufficiency? What would be the one thing that you would want to help?
That's a good question. I think for me, the awareness piece. Because I just feel every time she starts something new, whether it's, an extracurricular activity like dance, or every new school year, people aren't aware, people don't know what adrenal insufficiency are. I mean, I will admit I had no idea what it was prior to, my daughter being diagnosed with it. But I just feel like sometimes it's, I get the, really, you're doing this again, every time, something starts up, and, and I get it. She's, kind of, she hears the same spiel over and over again, but I need to know that she's safe. I need to know wherever she is that, people are aware. And I guess for me, and as she gets older and, sort of has one more year of elementary and heads off to high school, I think things are going to be very different. So I guess for me, it's that piece of, at least if there was more awareness about it and people knew sort of what it was and what to look out for, it would just be that, I guess, is, just, yeah, I guess that's a big piece of it. Yeah.
I absolutely hear you on that. Sharing stories and sharing our diagnosis and our journey is what helps bring about awareness, which is why NADF is so passionate about holding support groups or educating the community, because we do want to make sure that our pediatric individuals are safe and all of our members of our community are safe. And we do that by awareness. So that's one of the reasons we wanted to start these pediatric roundtables, in hopes that in the future we can bring everyone together and come up with ways that we can really support our children and see how we can help make this a safer, better world for them, utilizing the skills and the tools that we all have to make sure that they're supported and safe wherever they go. So I would love to just say thank you so much for sharing everything, and Sherry for being our parent here today and being our first to share. We are hoping to do more of these in the future, and we'll be in touch with everyone. We are going to try to keep the numbers a little bit small, just so that way everyone has an opportunity to share and connect with one another. But we'll be reaching out to let everyone know when the next one is and what we will be sharing and talking about those times. If anybody has ideas or topics or concerns that they would like brought to attention of NADF and to talk about at these roundtables, we would love to hear it. You can always reach me at nadfsupport at nadf.us and send all of your questions or concerns or comments my way, so that way we can help support your children moving forward. I'm going to go ahead and end our recording for the night and thank everyone for their time and energy, for being here, for watching, and for sharing and learning and helping to bring about awareness and educate and communicate with our community. So thank you, everybody. And I hope we'll see others in the future.